Well, 5 years later, there's still a lot we don't know about COVID-19. And one looming question in those early days of the pandemic was that treatment given to those with the most severe cases, well, was it the right one? National correspondent Christine Frizzell sat down with one doctor who says most US hospitals got it wrong, and their mistakes may have been deadly.
The scenes coming from inside hospitals in the early days of the pandemic were horrifying and heartbreaking. Patients diagnosed with a brand new virus put on ventilators, often forced to say goodbye to loved ones on electronic devices.
We literally watched my dad take his last breath on an iPad.
So it was pretty obvious in the spring and summer of 2020 that we weren't really dealing with a respiratory infection. It was actually a vascular disease of the lungs, and that's one of the reasons if you have a vascular issue of the lungs, the worst thing you can do is increase the intrathoracic pressure, which is what ventilation does, and in a sense is why most people that got on the ventilator did not live.
In fact, studies in the early days of the pandemic had similar findings. In New York's largest hospital system, many patients on ventilators didn't make it. Those ventilators also soon led to a resurgence in ventilator-associated pneumonia, or VAP, which dates back decades. One study looking at patients with VAP found the presence of COVID-19 was associated with a longer duration of mechanical ventilation and a higher risk of death.
I think a lot of people would be surprised to hear that the ventilator actually could have contributed to people dying. Is that right?
100%. Yeah, it's actually, if you think about the vessels, if you already have vessels that don't work very well, what's the worst thing you can do to them? Actually blow more air in them, increase the intrathoracic pressure, and actually close down more vessels and actually make the oxygenation worse.
Still, other more recent studies have shown those with COVID on ventilators compared with those on ventilators for other reasons had similar mortality rates. Ventilators, after all, are usually reserved for those who are already very sick.
Questions about treatment for the virus also include those about the COVID vaccine, especially in light of a new announcement. Health and Human Services Secretary Robert F. Kennedy Jr. just announcing the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. I'm Christine Frizzell reporting.